Oh yeah, that's a bright light. All right, how am I looking, Doc? Pretty good?
Looking great.
Oh my goodness. All right, Retinal Consultants Medical Group is where we are right now, and this guy taking care of me, he could be taking care of you as well too. Dr. Medina, good to see you.
It's nice to see you too.
All right, so tell us a little bit about where we are right now. What you guys do here? You specialize, right here?
We do. We act as consultants to eye doctors, basically, at Retinal Consultants. We take care of retina. So retina is the inside part of people's eyes, the photographic film that catches light and turns light into brain waves through the optic nerve, and is responsible for the vision.
Okay, so who would we need to be referred to come here? What type of patients actually come here?
Sure, well, we get everything, right? So we have patients that are referred by their eye doctor. We also have patients that are self-referred, or patients that are referred by their primary care doctor. For example, patients who have diabetes or other systemic conditions in their body, basically, that can manifest as retinal disease. By the time you get here, you've seen some of our excellent technicians where they measure your vision and they take precise, very high-tech ophthalmic imaging, so pictures of your retina, the inside part of your eye, that we interpret here. We then do an exam using bright lights, like the ones you just had, to look inside your eye and look at that retina.
Can we check out the place? Give us a tour?
Absolutely.
What are we looking at here?
Well, this is an autorefractor. With this machine here, we can check your vision. So we're gonna focus on image on your retina, and we'll check and see how well you can read that image. This machine right over here, we can take pictures and do something that's called an OCT, or an optical coherence tomography. And that'll give us a microscopic view of your retina.
Wow.
And it'll also look at the vasculature in your retina. So pretty sophisticated stuff to let us know if there's any functional impairment or anatomical changes in your retina that we would have to treat.
Yeah, I mean, we think health in our body, we think about that. Obviously, health, our eyes, part of our body, the health of the eye.
It's your window to your soul. This is that OCT we were talking about, and you can see all the blood vessels in the retina. And we can look at different layers to see the deep retinal layers or the choroidal layers. That's the wall of the eye. The retina, think of it as a wallpaper. This is the macula though. The macula is the central part. This little depression here is called the fovea. And that's where, we treat that macular degeneration. So basically we're looking in through the cornea, through the lens that when it gets hazy we call a cataract, into the eye where we have the macula, or the central part of your retina. And of course, we see a lot of patients with diabetic macular edema or swelling there, or macular degeneration, whether it be dry or wet.
Getting very interesting right now. I like this. Is there anything else we can see? Want to show something else?
Sure.
Like another one of your machines. I love the machines.
Absolutely.
Cool.
Absolutely. Come on over.
Let's go.
So this is our Veleda machine.
Ooh.
Veleda is a new treatment for dry age-related macular degeneration. So there's two types of macular degeneration. Macular degeneration can be dry and it can be wet. 1 in 10 is wet, and that's the patients that we give injections to.
Okay.
About 9 in 10 are the dry. And until recently, we didn't have any treatments. As of recently, we have, for the advanced form, we have injections that we can do here in our office every month or two. But now for the intermediate, when we catch it early, we can do light wave treatment. And we use this machine to deliver non-invasively, just lights. Wow. And in the LightSight 3 study, which was the studies that proved to the FDA that this instrument worked, we saw that patients with macular degeneration improved their vision. Some of them improved, some of them maintained, and that the aging changes kind of slowed down over time.
And you make it real comfortable when the client comes in, the waiting area is nice, you got the diplomas everywhere, people greeting you. It's kind of a comforting feeling to at least be here.
We try to guide our patients through every step of the process. It is scary, so most of our patients are getting injections in their eye or laser, or have had surgery or are getting surgery, and it's scary. So this is our bread and butter, this is what we do, and we guide our patients through every step of the process.
I like that. All right, well, hopefully my eye checked out okay and it stays that way, but if not, I know where to go.
You're doing very well.
Thanks for the tour, appreciate it.
It's my pleasure.
There it is. Go check it out. Retinal Consultants Medical Group. Great place to go. I'm telling you right now, they know more about eyes than you will ever know. And it was fun kind of getting checked out and going there myself. All the information right there on the screen. We'll be right back on Studio 40 Live. Don't go away.